ళకలక వ్యాధి ఇది రెండు తెలుగు రాష్ట్రాల్లోనూ ప్రజలను భయపెడుతుంది. ళకలక అంటే దీనిని ఆంగ్లంలో కంజంక్టివైటిస్ అంటారు. దీనిని నిర్లక్ష్యం చేస్తే కళ్ళకి ప్రమాదం ఏర్పడేటువంటి పరిస్థితులు ఉంటాయని వైద్యులు చెప్తుంటారు. రెండు తెలుగు రాష్ట్రాల్లో ఈ ళకలక వ్యాధి చాలా మందికి సోకింది. ఇలాంటి పరిస్థితుల్లో ళకలక నుంచి ఎలాంటి జాగ్రత్తలు తీసుకోవాలి అన్న విషయాలను ప్రముఖ కంటి వైద్య నిపుణులు డాక్టర్ కుతుబుద్దీన్ అలీ వివరిస్తారు.
Hi everyone, I am Dr. S.M. Qutubuddin Ali, consultant ophthalmologist. So as part of our regular healthcare update videos, today I am going to discuss you about the commonest condition I am facing in my regular OPD these days. So it is about seasonal viral conjunctivitis. As you see, there has been a lot of increase in the number of OPD patients approaching an eye doctor for symptoms like eye redness, irritation and watering for the past few days. So this as a clinical condition we call it seasonal viral conjunctivitis. Whenever the changes in the climate happen, suddenly from summer to rainy season and rainy to winter or so, there happens to occur such regular conditions which affect a large chunk of population. Now the season is such that we are getting so many cases of seasonal viral conjunctivitis presenting with these complaints. Most of the patients complain regularly of irritation of the eyes, excessive watering from the eyes and redness of the eyes and early morning stickiness of the lashes. So this condition, as we told you, it is a seasonal change of viral conjunctivitis. So whenever we see such cases, we ask the patient, how long do you have this history of symptoms? Majority of the patients, irrespective of the treatment or without the need of any treatment, within 1 to 2 days they get relieved of these symptoms with simple measures like frequent eye washing and maintaining good hygiene. But few patients, like more than half of the patients, sometimes may have these complaints in an aggravated manner. That is, they have excess watering, redness, which definitely affect their day-to-day life. For them, they definitely need some medication prescribed by the eye doctor. Generally, in the normal circumstances which we are seeing now, we are using antibiotic eye drops to treat the secondary bacterial infection, an ointment for long-lasting action, and also it is better to add a lubricating eye drop so that when the eye tissue becomes raw enough, rough enough, it already needs some eye rest and lubrication so that the surface become more smoother to function. Apart from that, the major thing that has to be taken care of is proper hygiene. So during COVID times, we have seen that we were so what we call diligently following the precautions that whenever we go out and come, we were following the hygienic measures like frequent hand washing, everything. But during this period of time, slowly we have lost that habit of maintaining those standards. But still, it is the time that we remember those times, and maybe not to that high degree of may I say that seriousness. Definitely it's always good that you need to have proper hygiene. Also, because the eyes will be always red, watering and irritation, they need proper eye rest. And the most important thing I have been telling all the parents who have school going age children is, if their children have this problem, maybe they got it as a first contact or they have received it from their friends, make sure you don't send your children to school, because once these children go, definitely no matter how much you ask them to follow the precautions, they are so close, friendly enough with their friends that the infection, and it is in a closed surface, so the infection spreads very fast, and definitely it is not advisable as a healthcare personnel that we can follow this. You should make sure that your child gets the proper care, proper eye rest and maintains good hygiene. You can take a letter or something from the doctor saying that this child has condition and he definitely needs leave from the school, and I don't think so no hospital, no school management will be having any issue giving those leave to the children also. And how does this infection spread? Actually, this is a contagious disease, that is, it spreads from one person to other. Not that by looking into each other's eyes, having a close proximity will spread this infection, but it spreads through fomites. Fomites are nothing but the towel, bed sheet, the things which the patient is using for his utility. And also when they touch the surfaces like doorknob, all these things, when the other person in the home, they are in the closed room in the same compound, so when they happen to keep moving through this surface, when they happen to touch the doorknobs and everything, the infection spreads to the other person. So whenever a family member has this, eye condition, he needs to make sure that he is getting the proper treatment. The other family members have to follow precaution, and no matter what it is, the virus is so easily transmissible that other family members will also most probably get this condition. But there is nothing to panic. When once the patient is already using some medicines, almost the same set of medicines will be prescribed for the other family members. Make sure that the set of medicines which the patient is using is restricted only to him. The other family members need to take a different set of medicines so that there is no transmission of infection. And first thing is, never panic. The main thing in healthcare management is you should never panic to such conditions which spread fast. You need to follow the doctor's advice, you need to follow precautions, and over the period of time it will come down. But at any time you feel that the vision is blurring severely, the conditions are very severe, never hesitate to consult your doctor. Never take prescriptions on your own or from a medical pharmacy, because it is accessible that patients get the medicines from the pharmacy, but they may not have the required antibiotic, or they may have some other medicines which do more harm than benefit. So make sure you consult your nearby eye doctor. Don't panic, follow the precautions, and share this message with your family and friends so that they will get benefited. And I hope that this is just a temporary situation. Over the period of 1 to 2 weeks, we will get relieved of this and we'll be back to normal. Thank you very much.